Good morning and welcome back. Well, March is Colon Cancer Awareness Month, and we're talking about that this morning with Gundersen Health System gastroenterologist Dr. Abdul Rehman. Dr. Rehman, thanks for joining us this morning.
Absolutely. Good morning.
So colon cancer, we're looking at the statistics. Third leading cause of cancer, second leading cause of death among men and women. It's kind of, to me, it seems like it's flown under the radar a little bit until recently. Why is so much awareness now?
It is indeed. It's actually the scope of the problem is quite significant. 5% of the general population end up having colon cancer during their lifespan, and as Brittany mentioned, and you have already touched, third leading cause of cancer in the United States, and the second leading cause of the cancer-related death. So it has been pretty. It's been a fairly common cancer, and it's falling under the radar because of some reluctance in terms of development of maybe new technologies, etc., and also awareness and some reluctance of the people to get screening colonoscopies, mostly.
What age should we be starting to think about colonoscopies and signs and symptoms and treatment? When should we start worrying about that?
So that's a good question. The age for general population for colon cancer screening is age 50, because most of the colon cancer, almost up to 90% of the colon cancer, occurs in patients when they hit 50 years of age. That's basically the most important cutoff. So everyone who turns 50, they should have colon cancer screening. However, there are certain populations who are at higher risk of colon cancer development, especially when they have family history of colon cancer, or they have a family history of colon polyps in their mother, dad, or siblings, or they have personal history of colon polyps. So they should have colon cancer screening starting early, like 40 or even earlier, and then they should have colon cancer screening more frequently than the general population.
Now, real quick, because we're running out of time, Dr. Rehman, give us a sense of how important that testing is. Getting it caught early, like colon cancer, if it's detected early, what's the success rate of treatment?
So it is now this is what you need to know about colon cancer. It is a preventable cancer, and if it is detected early on, it is 90% curable. So that's one of the most important things when it comes to colon cancer. Now, another thing that people need to know is colon cancer just doesn't happen in the colon. It generally occurs from small growths in the colon, which are called polyps. And those growths could be detected early on with colonoscopy. And while we're doing colonoscopy, we can detect these polyps and remove them at the same time, which not only make this colonoscopy a screening test, but also a definitive preventive test for prevention of the colon cancer.
Right. Yeah, lots of good reasons to get tested and be ready and get screened as well. Doctor, thanks so much for joining us this morning. That's all the time we have.
Thank you very much.